I think I would simplify it in a 6E formula. So I would give 6 E's, and they are very useful to remember and follow them. So the first E is about the eating habits, and we should eat healthy. We all know what is healthy, what is junk. So, like for example, fruits, veggies, whole grain products, they are all healthy. And what is unhealthy is excess salt, excess sugar, excess of oily food, fried food, excess of non-veg, excess of dairy products. These are all unhealthy. So we should include more of healthy stuff and less of unhealthy stuff, which can be tasty. So once in a while is okay, but it should constitute a little lesser amount. And when we are eating, we should eat in a very peaceful state of mind, because when we are eating, the digestive juices are secreted during that time. So we should chew it well. This chewing process, if you are just seeing TV and you are busy on the phone and you are eating, you are basically not chewing properly. You're just gulping it down. Plus, you are not enjoying. So the digestion of the food doesn't happen, so you don't get the stomach gets burdened with undigested food, so all the process of digestion gets hampered. And then eating timely, you should not have too much of haphazard time, eating very late in the night, missing out on your breakfast. And also these are three things which we should follow in eating. Second E is about the exercise, and we should have all three kinds of exercises. So we have cardiovascular exercises where you are running, cycling, jogging, anything which increases your heartbeat, which should be at least 30 minutes every day, 5 days a week. Then there should be stretching. So every day we should be stretching all our joints. Like for example, movement of the joints, movement of the necks, movement of all the joints should be moved to and fro. So three times this, three clockwise, three anti-clockwise. All these joints should be moved in a day, and it helps the lubrication as well as it increases the circulation. When you do twists and turns, it increases the circulation of the blood in the body. And this can be done every day during your workouts. Also, you can do it every 1 hour. You can stretch one joint. And third kind of exercise is toning. To maintain the muscle health, it is very important that we take up weights. We can either use our body weight or we can use external weight to tone up these muscles, which should be done twice a week. Now, third E is the emotional health, and that this is very important. And emotional health means your stress level, your positivity. So there are certain things which you can do. You can meditate. You can take deep breathing exercise while you are at a workplace. You can just take deep breath. Consciously take deep breaths, because it relaxes your body. And meditation can be done about 10 to 15 minutes every day. It cools your mind. And always reading. So first thing in the morning and the last thing before sleeping is reading some positive thoughts and all those things. So it keeps your mind positive and helps you fight these daily difficult situations. Fourth is exiting the addictions. So exit all the addictions like smoking, excess alcohol, tobacco, which is becoming a little more prevalent in females. And the fourth E is enough good quality sleep. So when I say enough, it is about 6 to 8 hours, and good quality means where when you wake up in the morning, you are feeling fresh. If you're not feeling fresh, then you should ask your partner or anybody who stays in your room whether you are snoring, because if snoring is there, snoring means obstruction to the airflow, and this obstruction to the airflow can cause lack of oxygenation in the body if it is too severe an obstruction, and cause a poor quality sleep even if you're sleeping 6 to 8 hours. And the sixth E is evaluating your risk factors regularly. So what are these risk factors? Or evaluating your numbers regularly. These numbers are your sugar number, cholesterol number, your weight numbers. What is your weight? What is your waist hip ratio? All these numbers should be measured regularly, because they are like silent killers. The sugar may be there in the body, the BP may be high, but you may not know, because these are silent killers. And unless you check them, you will not know that you have them. And if you don't know you have them, you will not take proactive action to treat them. So if somebody follows this 6C, especially a female, I think they can prevent themselves and make themselves proof. This is what I strongly feel and suggest to our all the women who are and ladies who are seeing this.